Dr. Paul, you're a pediatrician, and I'm going to talk to you about fever. Because this is probably one of the #1 questions that we get from parents, certainly calls in the middle of the night or to our advice nurses, my child's got a fever, what do I do? And a lot of angst and panic about the fact that your child has a fever. I just this week had a child who was barely 5 or 6 weeks old, and they had 100.4 rectal temperature at home. They called the advice nurse, it was middle of the night, and were sent to the emergency room. That's appropriate because there's something particular, 6 to 8 weeks and under, we take fevers very seriously. Beyond 8 weeks, that's a whole different ballgame. So let me first talk about the less than 6 to 8 weeks and what do you do? And what is a fever, first of all? Fever is 100.6, 100.4, 100.6, right around there. Fahrenheit, 38.2 degrees centigrade is the cutoff for an actual fever versus you're warm, but it doesn't quite qualify as a fever. Obviously, there's a range. There's always a bell curve on this. But if you have a child 6 to 8 months old and they are under 100, let's say, under 38, you don't need to worry. Just for easy memory, if it's over 100, over 38 degrees centigrade, you should take your child to be evaluated. If you've got a pediatrician that's comfortable evaluating babies, infants, go there first. If it's middle of the night or the weekend and your doctor's office is closed, you go to the emergency room. You actually go to an emergency room that deals with kids. This is not a situation you walk into an urgent care that's mostly used to taking care of adults. They won't know what to do with an infant that young who has a fever. Now, what are they going to do when you go to that emergency room or you go to your doctor's office? What are they worried about? And so we're worried about a special class of infections that's unique to that age group, which is why you have to take it more seriously. And it's also more difficult for very young infants to sort of do anything but grunt and cry, and they do that anyway because they're tired or they're hungry. So it's really hard to figure out. You go to a doctor that knows what they're doing. What are they going to try to make sure they don't miss? Something serious. Duh, Dr. Paul. Anybody could tell that. Well, what are the serious things we don't want to miss? We don't want to miss meningitis. Frankly, it's very difficult to tell meningitis in an infant, very young one, because they don't have the traditional stiff neck. So once you're past age 2 years, you will have a stiff neck. You will not be able to put your chin to your chest if you have meningitis. Meningitis is exceedingly rare though. It's something that I saw a few times, well, quite a few times when I was in my training back in the early 80s, but have seen maybe once or twice since then and none in the last couple decades. It's exceedingly rare. Thank goodness for that. So things have to be put in perspective if you're dealing with a pediatrician who's wise enough and old enough and seen enough that they won't necessarily have to jump to the spinal tap, which is the only actual way to rule it out completely. You take a needle, you stick it right into the lower spine, into this sac of fluid that goes around the brain all the way down covering the spinal cord. You pull off a little bit of cerebrospinal fluid, you send it for labs, and you can tell if they have meningitis or not. My baby that went to the ER amazingly did not get a spinal tap. That was actually a surprise, but a relief. And here's why they really didn't need it. So there's a lot of other tests we can do first to try to see if we can figure this out. One's called a CBC, complete blood count. You can tell from a CBC, it's not like yes or no completely, but it's very easy to see if this infection looks serious. You know it's serious when there's a white count that's sky high. Normal range for a little baby like that's probably around 4,000 to 17,000 total white blood cell count. If you're in that range, it's reassuring. If you're really low or way over 17,000 for a little infant like that, that's worrisome. Then we look at the types of white blood cells. Are they mostly neutrophils or are they mostly lymphocytes? And there's this type of white blood cell called bands. These are the immature neutrophils. When those are sky high, you got a problem. That's probably a serious bacterial infection. Or if the neutrophils are sky high, it's probably bacterial. If lymphocytes are sky high, it's probably viral. This child had mostly lymphocytes. No real other explanation for the fever, but there was a clue in the family history. Folks, when you take a history from somebody, don't forget to ask about how the others in the household are doing. Older brother had 4 days of fever and cough and cold symptoms. and we've got a CBC showing viral, so we knew this was a viral illness. They did a blood culture just out of added precaution, but no spinal tap necessary, and I agreed with that approach. Saw that kid the next day, and child looked great. Not on antibiotics, looked great. So that's how you deal with the 6 to 8 week old and under with a fever. How about the rest of the kids? Well, once you're 2 months old and beyond, I don't worry about fever. It is not a scary thing. It's scary only if your child is just out of it. I mean, you can't get them to arouse, you can't get them to smile, you can't get them to make eye contact with you, and they go from irritable to out and irritable to out. Okay, that kid with a fever, I'm worried. But before I worry too much, I'm gonna get the fever down and see how they look. Because here's the thing, when you get 104, 105, that would be in Fahrenheit, or you get a 40 degrees centigrade or higher, or 104 or higher in Fahrenheit. Most kids are delirious or really, really sick looking. That's a very high fever. Get the fever down. How do we do that? Fastest way to do that is get a wet washcloth, just pat it all over their body, put it on their forehead, put it on their neck, put it on their chest, move it around. As water evaporates off your body, your temperature comes down quite quickly. You can get 104 down to normal within a few minutes if you do that effectively. You could go into a lukewarm bath, try to do it that way as well. You don't want your kids shivering because they're so cold that shivering generates heat, but you can just sort of, latent heat of evaporation they call it, it just pulls the fever out of your body, lowers your body temperature. Now, how does your kid look now that the fever's down? If they look pretty good, no worries. That's the key. They look delirious, they look lethargic, they were super irritable, but once their fever's down, they wanna play, they wanna eat. You're good. You don't have to rush to the doctor, rush to the ER, rush to urgent care. No, sit tight and look for what else is going on. And I'll tell you what, the only things really that doctors can offer you besides treating the fever, which you can do from home, here's the rule of thumb there. Over 6 months, you can use ibuprofen. That would be Motrin, Advil in the United States, ibuprofen. Under 6 months, you're left with just acetaminophen, Tylenol, which I don't like to use ever, but if you were super, super desperate in a less than 6 month old, use it a few times if you need to. Acetaminophen is every 4 hours as needed. Ibuprofen is every 6 to 8 hours as needed. Dose it 10 per kilo per dose. All right, double check your dosing, double check with your providers, but that's the general rule of thumb. So, fever in those older kids that might need to be treated, what could it be that's causing that? Let's start at the top and go on down. Remember, meningitis, very unlikely, but after age 2, if they can do this, they do not have meningitis. If they can smile, they do not have meningitis, most likely. You still want to make sure they can put their chin on their chest. Moving on down, ear infections. If it's not a viral thing, it's probably an ear infection. That would be the #1 cause, at least in the preschool age group. Moving on down, throat, pharyngitis, strep throat. That's probably more common in your school age kids and older. And then moving on down, you've got pneumonia, lung infection. There's gonna be a cough. It's probably gonna be a productive cough if it's a bacterial infection. And then moving on down, super rare appendicitis. That's the stomach, intestines, and then where the intestines meet your colon is the appendix. And it can get inflamed and infected, and you can get very sick with fever. Here's the clue to appendicitis, just for those of you who are wondering I just had one today. Kid came in with abdominal pain and high fever. No, I'm sorry, it was just high fever. There was no abdominal pain, but I'm thinking, I don't want to miss appendicitis. That child had only had symptoms for 6 hours. There was nothing going on in the abdomen. You can push in, right? And if you can push in way, way in, and the child doesn't grimace, or you know when you do a sit-up and your abs just get tight, that's what a kid will do when they have appendicitis. They will tighten their abs, they're not letting you in. And if you really push hard enough, you don't have to ask them how does it feel, just watch their facial expression. If they're like, no big deal, it's not appendicitis, they're gonna like not let you in. Second clue on appendicitis is those kids will not eat. So that's the story you get. So they've got fever, you're worried about appendicitis, it's been 12, 16, 18 hours, they haven't eaten a thing, they won't eat. Worry about it, especially if they grimace at all. Get right into the emergency room with that. Don't want to mess around with that. Appendicitis can go to rupture, and that's a big issue. So we've got ears, throat, lungs, appendix, bladder. Especially if you're a girl. Girls, young women, girls, you get bladder infections way more common than boys. It's just anatomy. Where we poop and pee is a lot closer together in the female than it is in the male, so you can get contamination of bacteria from your poop into your bladder and you've got a bladder infection. If it's a high fever and a bladder infection, that means your kidneys are involved. And if kidneys are involved, there's a higher chance it's getting into your bloodstream. So that's a more serious thing to deal with. So if you have pain with urination, urinary frequency, you're going to the bathroom all the time, urgency, you feel like you got to go even though you just finished emptying your bladder, that's probably a bladder infection. If there's fever with it, it's probably kidneys involved. Definitely when there's fever involved in kidneys, you need a doctor, you need a prescription for antibiotics. There are ways to handle bladder infections without antibiotics, but generally you don't want to mess with that and have it risk going to your kidneys. Moving on down, there's not much else left, right, that can get infected unless there's something going on with your skin. So I covered the main causes, and then of course there's just viral. Actually, number one cause of fever is a viral infection. These are upper respiratory, cold and cough, or intestinal vomiting diarrhea. That's fever, but the key take-home message is don't panic. If they're over 2 months old and they look good, who cares? Fever is the best way your body has of dealing with what? Those number one cause of fever, the viral infection. So if you have a cold, cough, if you have vomiting, diarrhea, and you don't have ear infection, sore throat, strep throat, appendicitis, bladder infection, you want fever. You want the body to be hot. You want to burn out that viral infection. Viruses don't do well with high temperatures. I often wonder if you ought to just go and sit in a sauna or a hot tub, or I mean, obviously with kids you can't do that. You don't want to overheat kids. But the bottom line is, do not be afraid of fevers. Don't even treat it unless you're up into that 103, 104 and the person's getting lethargic or delirious, and you need to figure out, is that because they have a serious infection? Or is the fever making them lethargic and delirious? So you get the fever down, remember ibuprofen after 6 months rather than Tylenol, and just the compresses, if they look great, stay the course. You don't need us doctors. I hope that was helpful. Thanks for watching. Share if you like it. I'm Dr. Paul.